Hola, me llamo Doctora Bloom. Soy una doctora de medicina familiar en la práctica de Mount Oriad. Hi, my name's Ashley Bloom. I'm a family physician at Mount Oriad Family Practice. I became a family physician because I really wanted to work with people and help people, patients, during some of the difficult times of their life, but also to be able to celebrate those great moments that we see too. I like the challenge of it as well, of working as a doctor and getting to know my patients over time. When I was in medical school, we did these rotations where you work with pediatrics, you work with OBGYN, you do surgery, and I really liked each part of the rotation I was on, but missed parts of rotations I had already done before. And so when I got to my family medicine rotation, it just seemed like a natural fit for me. The goal for me of going into family medicine was that I can take care of families. I can take care of babies, I can take care of moms, I can take care of teenagers, as sassy as they might get at times. And I can take care of the grandmas and the grandpas, and so really multi-generations of families. Within that though, there are always areas of interest, of clinical interest for different family docs. One area that I'm really passionate about is women's health, as well as helping adolescents and learning how to become really self-sufficient and actually be proactive within their health. Especially with pediatrics, you see kids with these chronic conditions that as they become adults, they might not necessarily know how to take care of themselves because they really haven't had to. And I think that an important part of teaching kids to become adults is learning how to manage their own diseases. Well, and I think especially having a kid and learning how to be a parent and a doctor at the same time has been a really unique experience for me. A lot of my patients who knew me before I had a kid, they just started laughing after I had a kid and they would come see me because my advice changed a little bit. I really like to work as a partner with my patients. I don't view it as like a dictator kind of situation. I like to get to know my patients, know what their health goals are, and then help them to achieve those. Sometimes those are not necessarily realistic, but I think it's important to find baby steps towards reaching those goals for patients. One thing that I do differently from other physicians is I try to always make sure that I understand what someone's goal is for why they're coming in to see me, just because I might go off talking about diabetes, whereas someone might not really want to talk about their diabetes that visit, and that might be something that's more appropriate to talk about later, but they might have something, knee pain, back pain, something that they want to really address that day. So I think agenda setting is an important part of it to make sure that we're all on the same page. Yes, I speak Spanish, and I actually, when choosing my residency program, I specifically wanted to work with a clinic that had a large Spanish-speaking population because I really wanted to develop that skill. And so I am very proud of my ability to not just speak Spanish, but to actually speak it in a way that I can treat patients in Spanish. I chose to come to Lawrence because I've had the opportunity to live in a lot of different sized communities, and I really want to practice in a smaller town. I think the ability to practice community medicine as a family doctor is really a great asset to the community. I wanted to come to Lawrence specifically because of the vibrant small town closeness that is here.